Hello, and welcome to Boston Bone and Joint Institute. If you're watching this video, you may have a few questions about your Tricot arm sling. If you were provided with a pillow or have one attached to your sling, please proceed to the abduction sling video. This is the Tricot arm sling by Coreflex. The purpose of the sling is to protect your shoulder while you recover from surgery or an injury. This is achieved by keeping your arm and elbow close to your body. During this time, you will not be lifting your arm above your head through flexion or abduction and limiting external rotation. You will be provided with a protocol that will detail the instructions as to when the sling may be removed. Please refer to your protocol for length of use and any additional restrictions. Your sling may also slightly differ in style, as there are many models and brands, but generally they function the same. The Tricot arm sling is universal for the right and left side. The waist strap may or may not be used, which is at the discretion of your provider. To apply the sling, first place your elbow as far back into the corner as possible. Next, secure the neck strap in place by looping the strap through the hooks. If the waist strap is being used, reach around your side with your other arm to grasp the strap. Lastly, secure the Velcro strap to the front of the sling at your hand level. For proper fit, your elbow should be at 90-degree angle, your arm should hang and rest comfortably by your side, and it is best if your hand is covered or partially covered with the sling. You may notice a black loop on the inside of the sling. If it is comfortable, you may place your thumb here. This will help prevent your arm from sliding forward. To remove the sling, unfasten the strap through the hook. If using the waist strap, unfasten the Velcro at the front portion of your sling and gently slide your arm out of the sling. If you notice your hand falling forward and that your elbow is no longer at a 90-degree angle, you may need to adjust your sling. Oftentimes, when your hand slides forward, you may experience swelling in your fingers. To fix this, unfasten the Velcro on the strap that is across your chest. Give the strap a gentle tug, lifting upward. Slide your elbow back into the corner of the sling. Refasten the Velcro on the strap. Keep in mind, if you feel your hand is too tight or your arm is uncomfortable, attempt lowering the sling by adjusting the same strap in the opposite direction. If you feel irritation along your neck, you may need to adjust the placement of the pad. To do so, gently slide the pad either forward or backward to a more comfortable position. You may need assistance for this, as it is easier to do with two hands. To clean and care for your Tricot arm sling, you may hand wash and lay flat to dry or spot clean with a damp cloth. If you have additional questions regarding your Tricot arm sling, please refer to your post-operative protocol, discuss with your physical therapist, or contact our office by phone or message through the BBJI portal to speak to a certified athletic trainer.